Hi, I'm Dr. Nicolai Lennox, and I'd like to tell you a few things that you can do as my patient to help your treatment. The thing I think a good starting point would be if you could just drink a half a gallon of water a day. You think, oh my gosh, a half a gallon, that's a tremendous amount of water. Well, I think that's probably true. Usually most people aren't drinking anywhere near a half a gallon of water, so I'd like to tell you first why and two, how to go about it. The reason why is that your body produces a lot of waste material. And water is the great substance that carries some of the waste material out of your body. Your body gets rid of waste in classic ways, right? It gets rid of waste through the urine, it gets waste through your bowels, and it gets rid of waste through your skin, and it gets rid of waste through your mucous membranes and through your breath. And so you always want to help your body get rid of waste material because as your body is going through changes, you need to be able to allow those changes to get rid of old stuff. So how do you go about drinking half a gallon of water a day? Well, first of all, if you're drinking way less than half a gallon, you can't suddenly start drinking half a gallon right away because that'll just be ridiculous. So my suggestion is this. One, don't drink more than about 4 ounces of water at a time. And just gradually over the day, drink 4 ounces of water. You know you're going to pee a lot. I'm sorry, that's just how it's going to be until your body adapts to it. One of the things you could probably do if you wish is add just a little pinch of sea salt into the water so that it tastes sweet. If it gets so it tastes too salty, just throw it out and try again. Now a lot of people say, well, you shouldn't drink salt, shouldn't have salt. Well, I understand you shouldn't have table salt, and you shouldn't have the classical salt you get out of the stores, but just plain sea salt can be very, very good for you. The second thing I'd like you to do is to see if you can limit your sugar and your alcohol. Now, it's no mystery in the world that sugar is difficult for people. Now, there's other things you need to know about. Sugar and alcohol are both pro-inflammatory substances. That means that the net result of eating sugar and drinking alcohol is that you'll be more likely to have an inflammatory response. That means that things that irritate you are going to be more irritating. That means if you have a stiff neck, your neck's going to be more stiff. That means if you bump yourself, you'll be more likely to have a more inflammatory response to that. Now, this is not a philosophical thing about sugar and alcohol. This is a practical thing about sugar and alcohol. One thing that happens when you eat sugar and when you have sugar that's out of proportion to what your body tolerates, this part of your neck is going to lock up. Lower shoulder blades is going to lock up. So if you're coming to me with neck issues and spine issues, well, you know, it just doesn't make sense to come in and have treatment and then be promoting that same problem in your lifestyle. So what we've found is if you can just limit your sugar, if you have sugar every day, try not having sugar every day. Try to make some small increment of change that you can be successful at. You don't want to set a goal that is unachievable. You don't want to have 100% compliance because if you can't have 100% compliance and you're supposed to, then you'll have zero compliance and that's a failure and that's no way to go about your health. So try to limit how frequently you have sugar and alcohol. The third thing is to limit the amount of junk food that you eat. You know, oftentimes I ask people to write down their diet, to write a diet diary. That means for a week you write down every single thing you eat, every single thing you drink, every pill you take, any medication, any supplements, anything you do at all. And you write that down. And along with that, you sort of make a note of how you're generally feeling. What's the emotional status? Do you feel happy or sad, more pain, less pain? How are your bowels working? All these kinds of things. Now, you might think that that's an awful lot of detail that I require from you, but in fact what I'm trying to do is I'm trying to get your inner observer working for you because nobody really believes that drinking 5 cans of soda a day is good for you. Nobody believes that. And if you sit down and think about it, you know that automatically. So what happens when you start to write down the things that you're eating, the things you're drinking, you have a tendency to self-regulate. So people say, well, should I change my diet or not change my diet for that? I said, well, mostly when you're writing down your diet, you're going to change it because you're observing it, because you're committed to your health. Therefore, your behavior is just going to change. So that's a very, very important thing. The next thing I'd like you to do is to take a look at what kind of chemicals you have in your environment. If you're using very potent chemical cleansers, if you're using sprays, chemical sprays, bug sprays, if you're using things like Bounce in your wash or Febreze, those kinds of things that are designed to make things smell better and be cleaner, remember that a lot of people are very sensitive to those. And so what we want to do is see if we can limit those things while we're doing that. So just to review this, what I'd like you to do is try to drink more water. Try to eat less things that you know are difficult for your body. Try to have less chemicals that are involved with your body that you know there are going to be problems. And write down everything that you eat and drink and just see what you think about it. Most of the things that I do that I tell people, they already know. You know, half the reason I look smart is because I'm telling you something you already know. So do those things, and that means your treatment will be much more successful. I'll look smarter, you'll look better. That's good.